Pain. At some point in our lives, we have all felt it. That unpleasant feeling of actual or potential injury to the body. That feeling of discomfort or intense distress affecting our daily lives. Pain can vary in intensity, from something mild to something severe. It can be acute or chronic. In fact, 1 in 5 Singaporeans suffers from chronic pain. Pain can arise from a number of situations like nerve compression, tissue inflammation, fractures, infection, cancer, or even a simple sprain. Increasing pain may mean ongoing disease progression. Here are some common misconceptions about pain.
I think the primary one is that people really assume that pain is going to occur, it's inevitable, and that you have to live with it. And in particular, as you grow older, I think there's an assumption that pain is no more part of living, and again, that you have to live with it.
Pain is something that even if you go to a GP, they will tell you that, sorry mate, this is something you have to tolerate. It's all part of aging.
The truth is, you don't have to live with pain.
Pain is not a straight line. Research has shown that it is plastic and can be expanded. If pain is not treated early, it can result in chronic pain. Pain can present both as a symptom of the underlying condition or disease in itself for certain chronic pain states. Looking for the pain generator of some of these chronic pain can be difficult. Very often, patients are told that the cause of their pain is due to aging or degeneration, which is so far from the truth.
Dr. Bernard Lee has dedicated more than 15 years as one of Singapore's pioneer interventional pain specialists. He started a chronic and interventional pain management service in Tan Tock Seng Hospital as well as KK Women and Children's Hospital and went on to found Singapore PainCare Centre or SPCC.
My aims are to free my patient from the bondage of pain, may it be acute, chronic or cancer pain, and I like to provide an accurate, up-to-date evaluation of their pain conditions, to eradicate their pain generator or control their pain through minimally invasive pain procedures.
As its clinical director, Dr. Bernard Lee has established various clinical programs, including Singapore's first intensive rehabilitation program for difficult pain conditions. He has performed many firsts in minimally invasive procedures in the region, like restore spinal cord stimulator, ballooning neuroplasty, percutaneous disc decompression, and implantation of spinal pain pump. He has also been invited to many conferences to lecture in this area, both regionally as well as locally. He has since trained and mentored many doctors in Singapore and overseas in both the knowledge and the practice of pain medicine.
Honestly, there's so many different kinds of pain out there. One big group will be pain relating to the underlying disease condition, where the pain generator is obvious. The other group will be pain that persists on itself as a disease in itself, not due to any pain generator. Let's talk about the first group first. For the spinal pain will be things that are relating to compression of the nerves, resulting in very painful neck or back pain, as well as pain in the legs and the hands. For muscle type pain and the ligamental injury type pain, we often do see that as chronic type pain, but a lot of people will trivialize that, thinking that they ought to heal by themselves, but very difficult to treat if we don't target it accurately. Another big group that we often see would be the elderly pain. The elderly pain are often told that they ought to experience some pain as they age, but this is so far from the truth, because we can control their pain very well, if not get rid of their pain generator, either by changing their lifestyle or by giving them very simple treatments such as injections or medications. Last but not least will be a big group of the women's pain. We see a lot of women suffering from pain every day, especially the age group whereby they undergo menopause. And these group of patients, they are often stricken with pain and their lifestyle is so much affected, and nobody seems to understand. We would like to be able to control their pain well with using very simple techniques such as minimally invasive procedures or medication treatment.
As an alternative to open surgery, Singapore PainCare Centre seeks to improve the quality of the lives of individuals who suffer from acute, chronic, non-malignant and cancer pain through minimally invasive interventions, with a team of highly trained, fellowship-certified healthcare specialists in pain medicine, interventional pain procedures and anesthesiology.
The treatments at Singapore PainCare Centre would be minimally invasive procedures. After a patient has been evaluated that they are suitable for them, we will recommend that they undergo these procedures at the daycare centre. The patient will come in on the same day and be discharged on the same day, and they can go back to the activities of daily living the next day. And the advantage of having these minimally invasive procedures would be that they are safe, without complications, and they do not have to have any downtime. So almost the next day they can go back to their activities of daily living and undergo a rehabilitation program, and thereby the pain goes away completely. Some examples of this would be one, decompression of the spine using a percutaneous decompressor where we suck out the disc itself and string the disc permanently. Two, there will be a ballooning of the spine whereby we go in and try to balloon and open up a space permanently, allowing the nerve to glide freely. And three, we use a laser technique whereby we go in and string the disc, or alternatively desensitize the nerve to allow the nerve to be free from pain permanently.
The team consists of consultant pain specialists, neurologists, oncologists, pain psychiatrists, and rehabilitation therapists. In addition, a team of medical concierge is always present to attend to the needs of all the patients.
The team has a cohesive working relationship with other specialists and referring physicians, and thus, patients can be assured that the conditions will be treated effectively without delay. Patients' medical records can also be shared and updated in an integrated, effective, and hassle-free manner. However, it is the human touch that counts at SPCC.
Singapore PainCare Centre caters to the needs of the individualized patients through the Singapore PainCare experience. The centre provides an individualized treatment plan. After a thorough assessment, each patient will be given an individualized treatment covering from immediate to long-term plan. The plan may range from a variety of treatment ranging from physical therapy, pharmacotherapy, and minimally invasive procedures.
Life is completely a different way because you're always looking for the nearest place to rest because there's so much you can walk. So even when I went to the hospital, for this procedure, I would have to ask the nurses how far away is this treatment room and so forth. So can you imagine immediately after that, when you walk out of the hospital, that question is no more in your mind. You're prepared to walk to the car park. How dramatic can it be? It's quite dramatic.
走路有时很痛，有时你走了太快就痛，一点点就不会了。那个医生诊断很好，很好。我打了3次针就好，现在就没痛了。
手指、整个手、肩膀都疼痛，痛到说止痛药没有办法解决，针灸、一般的物理治疗都没有办法解决的情况下，我真的是整个日常的生活已经改变了。一般上这样的问题的话，只有2种处理方法，一就是传统到医院进行传统的手术，当然正如我所说的有一定的风险。另外一种的话，那么就是进行现在比较先进化的简单的一个处理手术，那么就是以细管进入颈部，把突出的部分摧残掉。那么在这样的手术是几乎可以说完全没有风险。手术之后，我可以这么说，出乎我意料之外，情况完全改善，疼痛消失了。那么我已经赢回我的信心，回到一切正常的生活。我甚至可以进行日常的跑动一切的上班工作，生活大致上很开朗。
focusing on multidisciplinary approach in the assessment of patients to arrive at a diagnosis. SPCC believes you don't have to live with your pain.
It's a great place to come. It's a very caring team. They know you personally. They make you feel important. They're very friendly. It's always a pleasure to turn up here.
Well, I mean, I really have only good things to say. I think the team was extremely professional. They assisted me, I mean, in the preparation for the procedure, past the procedures, and again, everything from my perspective went very, very smoothly. In fact, to a certain degree, smoother than I expected.
The Singapore PainCare Center's mission is to free patients of their pain and improve the quality of the lives of individuals who suffers from acute, chronic, non-malignant and cancer pain through comprehensive pain treatments, including minimally invasive interventions.
We believe that pain should not cripple a person's ability to enjoy his life fully. At Singapore PainCare Centre, we aim to eradicate the pain completely or reduce it without painful and costly surgery.